Hello guys, welcome back. I am Dr. Vandana Moiré, consultant radiologist. Today we are tackling a topic that every radiologist, resident and exam aspirant must master, MRI artifacts. So these are the distortions that sneak into our images, sometimes hiding pathology, sometimes mimicking disease. By the end of this session, you will know how to recognize them, understand their cause, and avoiding diagnostic pitfalls and role of AI in resolution of these artifacts. And this is the rapid recall. So be with me about 15 minutes. And this is the very important topic for the medical entrance purpose. So be with me and let's begin with. Now you should know the what are the MRI artifacts, its definition, causes of artifact, and its clinical significance or importance. So let's begin with the what is MRI artifact. It is unwanted features in MRI image that doesn't represent true anatomy or pathology. So this is the definition of MRI artifact, whereas the causes include the machine related cause and patient related cause. So machine related is the physics of MRI and technical errors, and this includes the complex interactions of magnetic fields, radio frequency pulses, and tissue properties, whereas the technical include the scanner hardware, sequence design, or reconstruction error. Whereas the patient factor include the motion of the patient, implants, or physiological processes like blood flow. These are the causes of MRI artifacts, whereas the clinical importance is that it can reduce the clarity of image and mislead the diagnosis. And its example is the artifacts are most commonly asked question in NEET PG, USMLE and FRCR. So its recognition is key. So know about the MRI artifacts and how to fix it. Watch the video till the end of this session. Most common type of MRI artifact is the motion artifact. So what it is caused by? It is caused by the patient movement itself, respiration or cardiac pulsation. So this will lead to the blurring or ghosting streaks along the phase encoding direction of the image. So this is the image showing artifacts, motion artifact. First image we can see that there is the blurring of image, and the clinical significance is that the small lesions are obscured by this type of artifact, and resolution is done by the immobilization of patient, cardiac or respiratory gating or faster sequence imaging. So we can see in this image there is a clear visualization of the brain parenchyma after immobilization of patient. So this is the motion artifact. An exam tip is that the motion artifact is the ghosting along phase direction. So you should remember that the ghosting along the phase direction is the motion artifact. Metal artifact. So what is the metal artifact? It is the artifact due to the metallic implants that disturb the local magnetic field, and it will cause the MRI artifact. So its appearance is the dark signal voids, bright streaks and distortion radiating from the implant. As we can see in this image, this is the dark band, and this will lead to the distortion of the image, that is the bone is distorted. So this is the appearance of metal artifact, and clinical significance of this is the pathology near the implants are hidden, and resolution is done by the Mars metal artifact reduction sequence or SMAC, that is slice encoding for metal artifact correction, and by using the high bandwidth. As we can see in this image, there is a first image showing the metal artifact in the femur, whereas after using the Mars metal artifact reduction sequence, there is a reduced artifact, and we can visualize in surrounding this metallic implant. So this is about the metal artifact, and its clinical call is the Mars fights metal monsters. So Mars is the sequence that fights with the metal artifacts. So remember as the Mars fights metal monsters. Now the susceptibility artifact. The cause of the susceptibility artifact is the field inhomogeneity at air tissue interfaces or hemorrhage. So its appearance is the black signal dropouts or geometric distortions. As we can see in this image, there is a black signal dropout with geometric distortion noted in the right frontal lobe. So this is the susceptibility artifacts. Its clinical significance is that it can exaggerate hemorrhage or obscure the anatomy. So its exaggerated hemorrhage appearance is useful in the diagnosis of intracranial hemorrhage. So it is very important in the clinical radiology. So its resolution is by the spin echo, short TE or high bandwidth MRI sequences, and its example is the susceptibility is exaggerated in GRE sequences. Now the chemical shift artifact or black boundary or India ink artifact. So it has the multiple names and it is caused by the difference in resonance frequency between fat and water protons and leading to spatial misregistration of fat signals. So it appear as the black-white band at the fat water margins are denoted by these yellow arrows, and the clinical significance that it mimics pathology at organ margins. So its resolution is by the fat suppression or in phase imaging, and it's mnemonic to remember in exam that the fat versus water tug of war. Now the herringbone artifact, it is also called the crisscross artifact or corduroy artifact. So it is caused by the hardware malfunction or corrupted data. So this is the due to the electromagnetic spikes by the gradient coils, fluctuating power supply or RF pulse discrepancies, and its appearance is the crisscross or zigzag herringbone stripes across the image as we can see in these images. So these are the regularly spaced stripes resemble the appearance of a fabric as we can see in this image that resemble to the herringbone pattern artifact. We can also see in this image there is a herringbone artifact, and its clinical significance is that the it is non-diagnostic, image is not non-diagnostic, and its resolution is by the equipment servicing or repeat scan. Crosstalk artifact or slice overlap artifact, it is caused by the overlap of the adjacent slices. As we can see in this image, there is the overlap of adjacent slices during the planning of image during MRI scanning, and its appearance is the signal loss or dark band between the slices. We can see as this is the dark band of signal loss seen crossing the horizontally through the axial acquisition. We can see this is the dark band, and its clinical significance is the reduced clarity of the anatomy, and resolution is by the slice gap or change angulation. Now the flow artifact. So cause of flow artifact is the movement of blood or CSF movement during the image acquisition lead to the phase mismapping, and its appearance is the ghosting or bright streaks along the vessels or CSF spaces. We can see as that there are bright streaks along the blood vessels. This is the dark one, the blood vessel, and this is the flow artifact, and its clinical significance is that it can obscure the vascular or spinal canal pathology, and its resolution by the flow compensation or saturation bands. So flow compensation is done by this is a technical parameter that can be applied during the scan to help reduce or eliminate artifacts caused by the flow. And the flow saturation pulses are these are the pulses applied to areas where flow is entering the slice to suppress the signal from the moving fluid, and using surface coils. So surface coils can help minimize unwanted signals from moving tissues located farther away. So mnemonic to remember this artifact is the moving fluid leaves ghost image trailing in phase direction. Now the Gibbs artifact or truncation or ringing artifact. So it is caused by the limited spatial resolution, and its appearance is the ripple or ringing near the sharp edges. So this is the series of parallel lines in an MRI that appear next to the high contrast boundaries such as the edges of the spinal cord or brain. As we can see in this image, this is the spinal cord showing this is the ringing artifact. So these are the parallel lines seen in the spinal cord, and this can mimic the shearings in spine, and its resolution is by the increase the number of phase encoding steps and use post-processing filters, and increase spatial resolution by increasing the number of data points in the image matrix or reduce the field of view. So these are the resolution techniques. And exam tip is for the Gibbs artifact is the pseudo serines. So remember that the Gibbs artifact can give the appearance of pseudo serines in spine. Now the aliasing artifact, phase wrap or wrap around artifact. This is the most common type of after the motion artifact. So this is due to the undersampling in phase encoding direction. This is due to the large size of the subject or patient and small size of coil. So this lead to the wrap around artifacts, and its appearance is the anatomy incorrectly mapped into the wrong location. So as we can see, there is the anatomy is overlapping over the first image. In this image also we can see that this is wrapped over the first image. So its clinical significance is the misinterpretation of the anatomy, and its resolution is by the oversampling or large FOV. So we can remember that as the aliasing artifact is the wrap around artifact. Moiré fringe artifact occurs due to the interference patterns when two sets of frequencies overlap, typically from the gradient echo sequences with improper phase encoding, or when the body is off center in the magnet. So this is due to the interference in the gradient echo sequences, and in its appearance is the wavy zebra-like bands or fringes across the images, as we can see in this image. And its clinical significance is the reduced clarity of image, distracts interpretation, and its resolution is by the spin echo sequences at the field homogeneity. So these are the resolution techniques. And the mnemonic for the Moiré fringe artifact is the it is due to the magnet mismatch, and think of mismatched frequencies creating zebra stripes. Artifact or RF artifact, it is caused by the extraneous RF interference entering the scanner room like electronic devices, poor shielding or open door, and its appearance is the bright linear band like a zipper running across the image and usually in the phase encoding direction. So we can see in this image there are some bright linear structures seen across the image, and its clinical significance is the can obscure anatomy along the line, making the image non-diagnostic, and its resolution is by the ensure proper RF shielding, close magnet room door, remove electronic devices and service equipment. And its mnemonic to remember is that so its name is zipper artifact. Think of a zipper line cutting across the image. Now the last one is the magic angle artifact. It is very important in the musculoskeletal system imaging for the evaluation of tendons and ligaments, and it is caused by the collagen fibers like tendons and ligaments oriented at 55 degrees to the main magnetic field, that is B nut, and it causes the altered T2 relaxation, and its appearance is the tendon or ligament appears abnormally bright on short TE sequences like T1, PD and GRE, and its clinical significance is that it can mimic tendinopathy or partial tear, especially in shoulder, wrist and ankle joint. As we can see in this image, there is bright signal intensity noted in the supraspinatus tendon. This is due to the magic angle artifact, and this is mimicking that the supraspinatus tendon tear, and its resolution is by the change in the patient position to alter the fiber angle, use longer TE sequences like T2 weighted images, and correlate with the other planes. And its example is the tendon glows when angle at 55 degree. Role of AI in artifact reduction, that is the appearance based detection. AI trained to recognize ghosting, streaks or banding patterns, motion correction, retrospective removal of ghosting, metal artifact reduction by deep learning reconstruction restores hidden anatomy, noise suppression, AI denoising improves SNR, adaptive reconstruction, AI fills undersampled data, reducing aliasing and Gibbs ripples. AI can detect linear interface pattern and suppress them during reconstruction. AI-based super resolution fills missing K-space data, reducing edge oscillations. AI can differentiate true pathology from orientation-related signal changes by training or large data sets, reducing false positives. MRI artifacts have distinct appearance on MRI from ghosting streaks to folded anatomy. Recognizing these patterns, understanding their causes, and applying solutions, including modern AI-based corrections, ensure accurate diagnosis and high-quality imaging. If you like my video, then like, share, and subscribe.